Julie Johnson volunteered to do that very graciously at the very last minute.
Oh,
Thank you, Julie.
Thanks, Julie. And then is there somebody who'd be willing to monitor the chat box?
This is Brian Ardrey. I can do that.
That'd be great. Thanks, Brian. And then Jay's is going to monitor the waiting room, and then any technical support, we might just have to help one another out with that one. Perfect. All right, Julie, I'll turn it over to you for number 2 there.
Hi, everyone. Turning my video on here, maybe. Okay, so our follow-up items, we had sent out the meeting notes and we have updated our FAQ, the Q&A document, and we also have outlined expectations for ISP documentation. We'll be going through that. Jays and I actually were just planning, and we're going to swap agenda items. So number 4 and 5 will be flip-flopped just to accommodate some of our remote working needs today. And we also have a very brief update on ICAP. So we're following up on some of the things that had come forward last time. We have an update regarding Governor Noem's executive order and the Appendix K on the agenda, as we noted in our action plans last time. So just kind of continuing to follow up with that, with our actions and following through and making sure that you guys have the information that you need when you need it, and following up on the future agenda for the items that we can't necessarily get to you in short order. So most of the follow-up items that we talked about last time are part of the agenda today.
Okay. Am I good to go into Appendix K and other updates? Okay. So when we met last time, we had the notice about the ability to flex our timeline on Appendix K. And just this week, we were able to get some additional updates on that. When we met last time, one of the things that we were committed to doing was to continue to work to see if there was any additional flexibilities to extend it beyond that March 12th. And so in visiting with CMS and hearing some of the things that they have that they're working on right now, CMS is actually working to address extending that Appendix K timeline. So we don't know what that's going to be, but we expect that they're going to be providing more guidance on that in the coming weeks. So as soon as we get that information, we will pass that along. They, again, are bringing that forward on their own. So I don't know at this point what the extent of that extension is going to be, but it's looking very, very promising. So as soon as we get that information, we will be sure to pass it along. They actually just today were sharing some additional information about things that may be considered as part of an extension outside of Appendix K. So when we move through and get to the other side of COVID-19, what are some of the things that we want to consider as part of what's in Appendix K and that we might want to do for an extension. And so that's something that I'd like for us to add to our next meeting, because certainly we'd like to be able to talk about that as a group. What are some of those flexibilities that, if given the option, we'd want to continue outside of COVID? So just wanted to put that in here too. So that's what I have for Appendix K today. And as promised, as soon as we get more information, we'll pass that along as soon as we get it. As far as the governor's executive order, when we met last time, the department was finishing our request for an extension. And so that has been submitted. It is in the governor's office, and we do expect to hear on that in the next week or so. So again, we will pass that along as soon as possible, as soon as we hear. So we asked for an extension to coincide with Appendix K. And so that's what we would expect if that extension is granted, that would be a similar timeline. Do you guys have any questions on that? No, I see some heads shaking no. Okay. Sounds good. And then is it going to you, Julie, or Jay's? I know you guys are swapping.
It's going to go to me. So sorry for the confusion. Okay, so I'm going to share my screen, and we did send the attachment. It went out on Monday afternoon, and then Jenny sent it to with the agenda for today's meeting as well. So let me just get that shared here. Make sure it's the right one. Okay, hopefully everyone can see that. So, you know, we've been talking for a couple months now about the documentation that we need for the service changes that happened between March and September 1st with people's services and their ISPs, knowing that some ISPs were delayed, but because the pandemic has just continued for so long, many ISPs have been held in this time frame. But essentially the document that I have showing outlines very basic terms of what we expect to be outlined in the ISP. This is the responsibility of the case manager in coordination with the ISP team. And we're asking that these updates be included in the ISP no later than January 31st of 2021. So we're asking that changes to services be outlined in detail in one of the following sections of the individual support plan. So there's the action plan section, which outlines the person's specific goals and the action steps that will be taken. There's a service support section of the ISP, which outlines a typical schedule and the service, the specific service the person is utilizing. A discussion record could be added to the individual support plan. We would like the topic of that discussion record to be stated as COVID-19 service changes. So it's very specific and easy to ascertain and find in that ISP. And we had provided guidance earlier this year that quarterly monitoring would be an acceptable place to document that as well. And so there are these 4 places that can be the home of this documentation. So I'm going to scroll down a little bit. One moment, please. Sorry about that. Okay, so what we're expecting this documentation to include is a description of the scope, duration, and frequency each service was authorized on the person's consumer service authorization in March. And so as an easy example, if the person on their March CSA would have had 35 hours of career exploration as a service, we want to know whether the service continued uninterrupted, if the services continued but at a different location, if it was suspended and you requested a retainer payment, it was suspended but you did not request a retainer payment, the service was provided in person but lesser frequency, or if the service was provided virtually. So basically any adjustments that you made for that particular service, for each service, we just kind of want a summary of what was revised. Again, we want as much detail as possible regarding how those revisions to services continue to support that attainment of the person's goals. So again, knowing that I don't think there's a person on the planet whose personal goals weren't impacted in some way over the past, eight months, but we really want to just know, how did the person's goals change and how did those services continue to support what that person was focused on at the time? And if that was simply staying healthy and limiting exposure to the pandemic, then that's appropriate. We do know that there were a lot of creative services being provided though, so we would really like to learn more about those, not necessarily in this documentation. That's probably more in line with what Joey mentioned for the December agenda, the flexibilities and innovations that have been happening despite the crisis that you're all going through. So if there were changes, if there were multiple changes to the scope, frequency, duration of those services during that time frame, we would like to, as much as possible, be able to distinguish how and when those changes occurred. So if the person started receiving day services in their residential setting, for example, and that happened from March 17th through June 1st, but then they started attending day services part-time this many days a week from June 1st through August 1st. We want to see the kind of a continuum of what was happening during those months. And for people whose IFP was held and the IFP was updated between March to basically present day, we want to just make sure that we reiterate that the action plan can reflect those pre-COVID services as authorized on that CSA, but we absolutely want to see a discussion record titled COVID-19 service changes. And this has to do with some of the complications that present when you have an updated ISP, but you've requested a retainer payment for X number of hours, or the fact that we didn't require a significant change request for those months. We want to be able to tie back what was on that March CSA and you might have been billing for, but we need to have some sort of documentation about how it was modified to support the person's goals and supports. Does that make sense? So it gets a little bit awkward for those new ISPs, but we know that a lot of people have had updated ISPs. So we just want to make sure that there is that tie back to the March CSA and the claims that you have all been submitting for that time frame. Beyond that, we've worked through this with our program specialist. If you have additional questions, you can contact our office, your assigned program specialist, Jay's or myself, we're available. And we do have this document posted on our website. It's just on our DDD landing page. So you can refer to it there, and we'll have a recording of this call on the provider resources portion of our website as well. Any questions?
Just to clarify, and I think I know the answer to this, but this is for everybody or just people who we requested retainer payments for?
This is for anyone whose services were modified between March and when we issued the policy that was effective September 1.
Okay.
So I would say it applies to all people, not just those who you requested retainer payments for.
And this is the responsibility of the conflict-free case manager?
Yes, so it's their responsibility to make sure the ISP gets updated, but clearly there will need to be coordination from, with the CSP to make sure that there are accurate records and that timeline is communicated accurately so they can enter the information into one of those sections of the ISP or the quarterly monitoring.
I think we had a discussion at an earlier meeting today that right now is really not the time, that we don't really have time to provide all this detail to the conflict-free case managers. We're in the middle of a pandemic and all of our energy is going there. And this is basically recreating something back to March. I'm just speaking for what was stated earlier in the day.
Yeah, Julie, this is Brian. I know when I shared this document with our staff here at Advance, we have two people who are our internal support coordinators, and we've been hit really hard like everybody else has with COVID the last few weeks. And we've got everybody pulling double duty and wearing multiple hats. Director level staff, working shifts, support staff, our internal support coordinators are making meals during the day to send to houses for lunches and supper so that they can care for the people who have COVID. And just talking about having no idea where they would have time to be able to pull information together and pull dates together, even though it's not due till January 31st, conflict-free case managers will need that information before then so that they can then have it entered in before the 31st. And so just, you know, I hope COVID slows down here. It doesn't look like it's going to anytime soon, but I just have very serious concerns with our ability to get this information together so that it can be submitted.
Kimberly from Lifescape. I would just like to second that. We are in full implementation of our emergency preparedness plan. We have people redeployed across our entire organization. We've got 2 COVID positive units up and running. We've got 16 people supported with COVID. I've got 30 staff. I've got 17 pending tests. I've got 35 people out because they can't work. We can't do this. Yeah, I don't know how we can achieve it.
I'd like to hear from first of all, thank you both for sharing that. Certainly we hear you. I'd like to hear from the case management agencies who the responsibility for completing this falls on. Where are you guys at with this?
So I'll speak up. I think that this is going to depend a lot on the community support providers to be able to provide us with the information that you guys are asking us to document on. I think I stated this in our, you know, when we saw the draft of it may be really challenging even to have that information from the earlier months, you know, when the pandemic first started, because it was week by week. So there may not be a lot of information to even provide or to gather in those earlier months, because literally it was like day by day we were learning. And so I think this definitely has to be in partnership with the community support provider. And I will tell you, as a case management provider, I don't want to add to the stress of what they're going through or minimize what they're going through. And the logistics of this policy memo, like number 1 and number 4 seem to almost contradict each other. When I was reading it, when the final came out, where if number 4 were to say from September 2nd through present, then it would make more sense to me. But it was like, so which one are we supposed to follow, number 1 or number 4? So maybe some clarification on that, but I don't, you know, this is a DDD requirement. If it's a Appendix K, maybe more information on what's the minimum that can be provided to meet what you guys need. I don't know. Sorry, that was winded, but there you go. You all know that from me.
Thanks, Katie. Anybody else from a case management? We'd sure like to have a conversation with anybody who's willing to address this with us, please.
I would echo everything that Katie just said. We do not want to add to the stress of community support providers. I think across the board, everybody is doing double duty or triple duty, and the timeline could be really a challenge.
Thanks, Amy. Other thoughts?
Joy, this is Laura. Did you say, or does the memo read for every service open on the CSA? There must be documentation by the case manager? Or am I reading that wrong?
Where are you looking at that, Laura?
Description of scope number 2. I just wrote some notes. Julie, I guess it was Julie, sorry. Any adjustments made for each service open, detail as much as possible.
Yep, that's accurate.
Would we need copies of CSAs, or just gathering the information? I don't know.
You know, I would propose, so let's talk about this. What if we take this context? Certainly we tried to have some early conversations before coming to this meeting, and I feel like maybe that we didn't quite have the end result of that as our intent was. And so I would like to propose that the division work with case managers to take another look at this. And then for us to come either together as a whole group or maybe a subgroup to figure out how we can make this work. Because certainly there are things that were impacted by COVID, and we had some extension within our authority, and there's things that aren't, that are not even within our control. And so maybe looking at how we can make parts of this work if we can't do the whole as it is. So if there's folks that are willing to have that conversation with us, please let us know, because we would like to be able to move through this in a way that makes sense for everybody and still holds us to our requirements. So thoughts on that?
Joey, this is Tacey, and I know when I brought it to a few of our case managers, we approached it with some in every region. They thought that this was actually doable. However, they worried that the information wasn't going to be accurate because we really need the help of the CSPs. And if, you know, and I totally understand that you guys are overwhelmed right now. So that's what my case managers worried about. Like, they could do it, but they're just not sure. It would be a lot of guessing.
So, and there might be gaps. Is that what I'm hearing? Like the case management entities could pull things together, but there will be gaps without that partnership from the CSPs in it. Okay.
Correct. Yep.
So how do we propose moving to a resolution for this? Does it work to continue the conversation, or what's the preference out there?
Joey, this is Jody, and I'm just wondering, from New Horizons, and I'm just wondering, is there any way we could work around having to have, you know, specific dates that everything happened, and just say, you know, during this time, this is the services that were provided and how they were provided, and not have to be quite so specific on everything?
So Jody, are you saying, can we do more like a high level summary versus the greater detail that would be more burdensome together?
Yes. Yeah.
Okay.
Instead of saying it happened on, you know, March 28th, this happened, and on April 3rd, this happened, just saying during March and April, we had to reduce services. The person was at home. We provided, you know, Zoom meetings with them for this many hours, or those kinds of things.
Yeah. So we will look into that and see if we have the ability to have some of that flexibility, and we can include that as part of our circle back. That's a great question. Other thoughts? And Katie told us we're out of time, so I'm trying to be respectful of people's time too.
VistaCare had a question as well, wondering about the requirement going forward regarding changes after the ISP is updated.
So my question is, can you hear me, Joy?
Yes.
Okay. So I kind of have a two-part question. So let's say that the ISP gets updated by January 31st for the services from March to present. What happens if there's changes after that date? Is the ISP expected to be updated as those changes are made in real time, or is there another delay in updating those going forward? My second question is, I've missed some conversation around this, but I would assume the goal or the intent of the service change documentation is just so that we have some sort of record of where people are getting services. Is that the goal or the intent?
So the answer to the second question is yes, because we did not require significant changes to be submitted until we issued the September 1st memo. We have no paper trail for how services were modified, what the hours were, where the services were occurring. We have no way to verify any of that. And so what we want to avoid, and kind of the why we're doing this and requesting of the look back is because if there's a DHS claims review, if there's a CMS review, if the CSA shows 40 hours of day services as an example, and there's not documentation to back that, and there's nothing in between to say here's why it was modified, we know things were done to accommodate and limit exposure. But if there's nothing in between to document how that was accomplished, then we're going to be in a position where we provided guidance to not submit an SCR, and our claims department is going to be in a tough position and not able to verify if services were provided as claims were paid. So that's the answer to the second question. I think I might need you to repeat the first question because I was kind of formulating the answer and then you moved on to the second one. So if you can repeat that real quick, that would be helpful.
Yeah, the first question was, what's the requirement after, like, let's say this all gets ironed out and all the ISPs get updated by January 31st, which is unlikely, but what's the requirement after that going forward? Like, let's say a house is, you know, self-quarantined or services stop or whatever. Is the expectation that the ISP be updated in real time as each individual case changes, service changes, or?
So effective September 1st, for changes that have happened after that, we're requiring SCRs for any changes that last longer than 30 days. So that'll be covered through the significant change request. So, I mean,
gotcha.
Ideally, plans get updated when the SCR is submitted, but, you know, at least we'll have some sort of documentation and a paper trail by which to follow that.
And Katie's being so generous. She's given us 5 extra minutes. I would just say with this one, we'll try to regroup on our end and pull together to determine how we'll proceed with the documentation for ISP.
So I think that takes us over to Jay's, and Jay's, I can share my screen with the FAQ document. I have it pulled up here. 1 second. Okay. All right, good to go.
Thank you. I will preface, I am working remotely and I have a very vocal 5-month-old who might feel the need to chime in.
Jay's, as needed, you just let us know and one of us will help carry it, okay?
Okay, so I will do my best. And I certainly apologize for any interruptions. Okay, I don't know if you've tried to reason with a 5-month-old. It's not the most effective. So we decided to combine. We had previously issued a frequently asked questions document back in April, and then we decided to combine that with the retainer payment FAQ that we had issued because we're realizing now as we have rolled out, and we rolled out quite a few changes back in March, April. We have to continue to kind of monitor and make sure, I'm really sorry, that the guidance is staying up to date. So we felt it was best to combine the 2 FAQs into one document and also update things that we had stated back then. And so, and we also then added additional questions. So we've broken out the FAQ into sections. So just some general COVID-19 questions, as well as then a section that focuses on retainer payments and virtual supports. So questions 1 and 2 are new to the document. And so we've talked about what are our requirements for reporting if a staff member tests positive for COVID-19. And so just as indicated in ARSD, in 4611-0601, each provider, goodness. Okay, it's just the requirement that you have to have a health and safety and sanitation plan, which does require notification to the division of any staff positives once you've become aware of the diagnosis. And what our expectations are essentially that you're following along with your policy.
Jays, do you want Julie, myself, or someone else to
Yes,
continue?
please. Thank
Okay.
you.
Rock, paper, scissors, who wants to go?
Joy, if you want to go ahead.
Okay.
Okay.
So the second one, is everybody good with the first one? That's clear.
Is there any way to, this is Shirley, is there any way to suspend the notification of staff, any staff? We can't share their name with you. The Department of Health has all that information. This was a change made in the rule that I believe Jennifer and other people had maybe rallied against. It seems we're following our policy, but it seems rather pointless.
Yeah, and the way that rule set up is because the requirement is for communicable disease. That's why it's in there. And you're right, we're not asking any direct confidential information. At this point, it hasn't been a part of the COVID-related exclusions. And so, certainly, I think we all know numbers are rising quickly. So at this point, it's still a requirement, but certainly it's something we can continue to visit and discuss, Shirley.
So I guess I have another question regarding that. We haven't been calling these in. We tried in the beginning and we were kind of told we didn't have to. So are we gonna, what do you want us to do with this?
First, oh no. I would just say if you have not been, please start. And then again, this is going to be something that we're going to have to keep revisiting because things are changing so quickly. And at this, like I said, at this point, it's still a requirement. And certainly we want to be flexible in that. So any other questions on one? The second one then, as far as does DDD expect providers to have identified back to normal plans? As you can see there, we strongly recommend that providers develop the pandemic response plan to provide clarity to self-advocates, families, and employees regarding the COVID prevention, risk mitigation, and response. Any plan developed or used by the provider should be shared with stakeholders in DDD. Do you guys have any questions or concerns on this one? Okay. Number 3 then, what will the division look for as part of the new Choices Smarts review process, which only reviews for COVID supports and prevention of abuse, neglect, and exploitation? So effective November 1, we're resuming standard monthly file reviews to ensure compliance with ARSD and the Choices Waiver performance measures. But also starting in November, we began conducting policy implementation reviews for providers that were due for recert in FY21. So that's where we're at right now with beginning review processes as well. Number 4, is the division considering suspending the annual medication administration proficiency requirements for staff who are already trained? Yes, in fact, it's included in Appendix K. The next one, as far as new staff training requirements, is also still suspended as part of Appendix K. Is the HRC, if the HRC is unable to convene due to COVID. So as you guys can see there, right now this is not impacted at all. It's not included in Appendix K or the executive order. So those things must continue at this point. We understand the challenges of convening the committee members to attend meetings during this time, and certainly will allow short-term limited review of restrictions and BSPs to occur. This means that at least one committee member not employed by a provider implementing the restrictions can authorize the restriction. Any questions on that one? Okay. Number 7, where can providers get PPE? So The email to request PPE is there. And then you can also call the 1-800 number for more information or to request PPE. Number 8, can providers designate their staff as essential? Providers may designate their employees as essential at their own discretion. The division has provided examples of essential employee designation templates. So that's something that right now you can do. And I know from earlier conversations and the Joint Committee on Appropriations was talking about some of this today. So I would assume we'll have some updates on this at some point. Number 9, we're working with our psychiatric PA on telehealth options for people who have ongoing psychiatric needs. What additional information can be provided regarding telehealth, specifically for services in rural areas and crossing state lines? So here to answer, we provided some links to the most current FAQs and Medicaid's telemedicine policy. So please go check those out and let us know if you have any questions. Number 10, how will the federal stimulus relief checks and pandemic unemployment insurance benefit affect a person's Medicaid eligibility status? So I think we've talked about this one before, but the $1,200 stimulus check is not counted as income. And it will also be disregarded as a resource as long as it's spent within that 12-month time frame of receiving. Number 11, due to COVID-19, has there been any consideration of suspending co-pays for people on the choices waiver who have an earned or unearned income above the limit? So there's currently nothing in the bills going through Congress which waive this eligibility requirement for Medicaid coverage. And certainly we'll continue to watch for that. I don't think anybody thought in March that here we are in November, that we would still be where we are. So we'll continue to watch for that as well. Are required fire drills considered, are required fire drills being considered during COVID? At this time, the division does ask CSPs to maintain their safety and sanitation plans to ensure the health and safety of participants, including those scheduled fire drills. The next one there is ENF available at this time? And if so, can ENF cover COVID-related costs? So the division is able to process standard ENF requests as long as the budget's available. And certainly, please continue to submit your ENF requests as you normally would. And we will continue to work to accommodate those requests as we can. Let's see, retainer payments and virtual supports. So we're moving into the next topic. Before we do that, any questions on any of those?
Joey, I hate to go back to number 1, but can we provide that information on a staff positive to our program specialist through an email?
Yes,
and
absolutely.
What should be included, since we're not including just a staff has tested positive on this date?
Perfect.
No, don't need a location or anything, just that information?
Correct.
Mm-hmm.
Thank you. Sorry to go back.
Nope, not a problem.
Katie's reminding us 4 minutes left.
Oh my goodness. Okay.
So I was just going to say, Joey, that a lot of these were already in the FAQ. And so
I don't need to read
them. Some of them haven't changed, which,
perfect.
So I mean, I can maybe, as I scroll, kind of go through it, and some of the answers have just been revised, so they're more condensed to be clearer.
Okay.
And so as we scroll, I'll try to point those out a little bit. I didn't realize until we were halfway through that first page, like,
yeah, I know. I was like, this is going to take a while, and I really don't think I need to read everything to you guys, but I'll try to just skim through it. So as far as retainer payments and virtual supports, we know that the attestation is required. And then number 2, no, you can't request retainer payments if a person leaves for vacation, for example. Number 3, is there any additional things here?
That one has been in there. Essentially, that's just, whether or not there was a goal being met, and the retainer payments qualifying.
Perfect. And then the eligibility for retainer payments, that's been, I'm not sure we've updated that anytime. And in hearing from CMS, at this point, there won't be any extension beyond that 3 30-day retainer payments at this point, because they don't have any policy changes planned at this point. So the next one's the same.
Number 5 is a new one.
Okay.
So this is something that Liliana and I had worked through. And so this essentially just says, please submit the retainer payment request at the end of the 30-day period, because if you're submitting it, halfway through or at the beginning, it's really hard because, again, things are changing every day. If the person is planned to return to services, say November 29th, but we get that today, we really have to do a lot of follow-up to ensure that services did resume on that day. So if you can wait until the end of the 30-day period to submit that, it just makes the process much more seamless on our end, Liliana's end specifically, and then any follow-up that's needed by the CSP or case manager too.
Perfect. So with that one being new, any questions on that piece? If you do, certainly you can take them to your program specialist as well, or follow up with one of us after the meeting too.
Number 6 has been, that was on the last iteration of this. I just cut down the response so it was not so wordy, really. So any changes that continue for over 30 days require the significant change request.
Can I ask a question about the policy memo reference there? When was that sent out? I don't have access to that.
So I believe that is the absenteeism policy, which is
1104.
Yeah.
Is there any way that could be resent?
Yes.
Yeah.
It's an older one, Amy, so we will resend it.
Thank you.
So this is Jennifer. Is there any database or anything on the division's website where those policy memos are stored and the most recent or up-to-date ones are available for us? I appreciate you sending them out. I'm just wondering if that's already available, or if in the future that could be done.
Yeah, that's something that we have considered putting on our website. It's taken us a while amidst all the other things that we have going on, but we do have now we have basically a list of which ones are applicable, which ones have been superseded, which ones are not applicable anymore. So I think, using that as a guide, we certainly could add some of the policy memos to our website. It just is going to take a little bit of effort to make sure that we have all the most current versions and a place to house them. So that's something that we definitely will consider.
Yes, and for sure, that's something ideally in the future we want to have a one single location for those things.
Yep.
Thank you.
Number 7 and 8, I believe, are, let's see, 7 was in the FAQ before, and we've added number 8. This was added as a result of some of the conversations we had between, the beginning of September and just a couple weeks ago. So we're just outlining some of the billable versus non-billable activities. So, I really appreciate those of you who came forward and asked really specific questions about what you were doing to supplement people's services. This is just one example. I'm sure there are many others, but we wanted to make sure that we were very clear on what counts as billable time and what does not for some of those services that were being provided, where there wasn't necessarily any in-person contact, but you were providing materials to the person. Any questions about this one?
And I think we're over time, so I don't know how much quicker we want to roll through this one.
I'm kind of scrolling. So number 9 is new, but again, this just clarifies if you made attempts to get in contact with the person, but but you weren't able to successfully do so, that would not be considered billable. We talked about the number 10, that's been in here. 11 has been in here. Number 12 and number 13. Again, the responses to those, the premise hasn't changed. We just rephrased a little bit to hopefully clarify, because we had a lot of questions about that. So any questions about the reduction of services? Because I know last time we met, there was a request that we talk more about that. Sorry, I'm scrolling all over the place.
This is Amy again. With the reduction of services, if a person is living in a level 1 and level 2 setting, and they've gone home with family and they left after September 1st, then we do the reduction of services notice to decrease their services to living with family. Do we also need to end their day services or any other employment services at that time, like career exploration or a meaningful day?
Are you able to do any of those virtual, like as a virtual support?
We can provide like a once a week contact, but if they left after September 1 and it's been more than 30 days, the policy is to reduce the service, right? So what would we, so are you suggesting we could just reduce the day hours to how frequently we could provide a remote support?
Mm-hmm.
Yes,
Okay.
and I think that was what our original communication was as well, but we haven't maybe spent enough time on that. So that's a great question, Amy. Yes. Okay, we are 5 minutes over. Running behind today. So please take a look at it. If you have additional questions, certainly let us know. This is something we can continue to bring forward in these meetings as well.
Mm-hmm. Okay, so I'm going to stop sharing and go back to the agenda really quick. So essentially, okay, so the last item that really is very brief. We have ICAP training videos available on our website. They're available on the provider resources page. And there's a section dedicated to ICAP. And so there are right now 5 different recordings available. And so we broke into ICAP training into sections essentially. So there's an introduction and completing the cover page. And then there is completing several sections, I think, A through C, and then filling out the adaptive behavior and problem behavior. So it's broken out into more manageable bite-size pieces. So knowing that we're coming up on ICAP, the 3-year submission, please feel free to refresh your memories on all or any specific portions of the ICAP completion that you need to. We don't have a specific ICAP policy memo prepared yet, but we are working on carving that out. And so we'll hopefully have more information for all of you in the very near future. And I included the link in the agenda to the provider resources page as well. Okay, let's see here. Then we have, do we know what we're expected to do before we meet again? So I'm gonna just kind of list off a few of the things that I have written down. So we're going to reconvene within DDD and likely with case managers to take another look at the ISP documentation policy. We will resend the policy memo 1104, which is the absenteeism policy. Let's see here. Julie, JD, as you're taking notes, are there other things that you had written down?
The other thing that I have written down is that Joey asked to have any exceptions for Appendix K that aren't on there now that you'd like on there, or you know, anything moving forward to be sent to her.
So, and I think that was related to the flexibilities included in Appendix K that we might want to consider outside of that. So that's something that I would like, if you have those, to please send those to me, because I would like that to be one of the things that we discuss as a group at our next meeting in December.
Julie, for the group that's going to get together to discuss the documentation, could there be a representative or two from the community support providers on that group?
Yeah, we can certainly do that.
I'll scan through these notes again, but I think that's all I had that you had mentioned, Julie.
Okay, thanks. So then beyond the flexibilities that we'd like to consider as we kind of unwind from COVID, what are some other items that you'd like us to address? You know, what should we spend our time on at our next meeting? I know this is not a quiet group.
Last time we met, we had talked about there potentially being a Q&A guide or a new guide in relation to a significant change request. And there's been so many different changes. You know, it seems like the first policy memo that I can recall seeing said to do an SCR if a change was expected to last 90 days or longer. Now it seems to be more like 30 days. So I was just wondering if there could be like a new policy memo or something that would describe the expectations in relation to SCRs, both during this pandemic and beyond.
Yes, so we can bring that forward. So we've been doing some internal work with some of our external partners on revising the SCR process itself. And so we can certainly bring an update to the next meeting of where that's at. Our hope will be, once it's finalized, that there will be some training for everyone that will occur as well.
I did find another item, excuse me. Go ahead.
I would like to at some point discuss the Therap IDF form and where we're at with getting a unified document there, since our timelines keep getting pushed back, and just other things that are going into that process.
Perfect. I've written it down. We will bring it to December. Thanks, Julie.
Yep.
The other thing in the notes that we haven't talked about is there was the request to, you know, discuss the staff reporting of COVID, and we know we got to continue to do it like it is now, but discuss whether that can be something maybe in the future. Not to
Yes, perfect. That's yeah. Did you have that as an action item for us to report back?
Yes, I do.
Perfect. What else, or do we feel like we have a bit for our agenda for next time? I can add to that any additional updates that we might have for the Appendix K and executive order. Certainly, we would hope that we would have that information out before then, but we can put it on here as a hold for that conversation as needed too.
Can I add one other thing that you guys might want to take back and discuss that came up at our policy implementation review? In regards to record retention, it was brought to our attention that if somebody transfers to our agency, that we are responsible for getting 6 years worth of information from the previous agency for that portion of record retention. And I don't know, I've been here almost 30 years and I've never heard of that. And so I'm just wondering why that would be a thing, or how that's even going to be possible, because I don't see agencies digging 6 years into their files to send to us if we're admitting someone.
Yes, Julie, we will bring that forward.
And just one other issue with the desk audits, having to send in OIG background checks and drug screens on 95% of our employees. If that could be done when you're in our facility versus us sending all of that as a possibility as well.
Yes, surely we will take a look at that and review it. Have you already done that?
We're supposed to by December 1st, and I asked this question and Carrie was supposed to get back to me. I was just wondering if it
Okay.
had been discussed yet.
Perfect. So we will get back to you before that, before December 1st. Any other outstanding? We have 1 minute.
And Shirley, you have till the 16th of December, so don't short yourself with your.
We just want to get everything in before
no,
the holidays. But I just think it's crazy that we have to send all that in.
Okay.
Okay, anything else? We are at time. All right, well, if you think of something, please let us know. And again, we appreciate your willingness to have the conversation. We enjoy having everyone together in this platform. The ability to share information with everyone at the same time is extremely helpful. So if you have ideas for things we should be doing differently or we should be doing more of, please let us know. And then we look forward to our meeting next month. Thank you.
Thank you.
Yep, thanks.
Thank you.
Thanks, everyone.
Thank you.
Bye.